blood tests to rule out other causes of hair loss other than male pattern baldness? 26. Male. What blood test should one consider to rule out other causes of hair loss? For instance, iron deficiency, thyroid, etc.
Thank you for your question. You're asking if there are blood tests that would help determine if there are other causes of your hair loss besides male pattern hair loss at the age of 26. And you give a couple of examples. Well, certainly I can assist you with the evaluation of hair loss and what comes to mind when I examine a patient and I take a patient's history who comes to our practice. A little bit of background: I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and hair loss treatment has been a big part of my practice, particularly in the area of non-surgical hair loss. We've also been performing hair transplant for many years. So when a patient comes in and will give me a history of their pattern of loss, let's say for a male, we first look at family history. We look at mom's side of the family, dad's side of the family. Invariably, we're able to establish some degree of a pattern within the family. It's often stated that certain patterns, such as maternal uncle, is how it works, but it really doesn't work that way. It can be sporadic, it can be variable. 11 chromosomes are associated with hair loss, so you can certainly understand how that mix can be associated with the genetic roll of the dice. Now, that being said, we also certainly look at general medical health. And certain blood tests which are routinely performed as part of a general physical examination for men is usually adequate. And that includes taking vitamin D levels. It is common for there to be a decrease in vitamin D levels, and we always, of course, recommend taking vitamin D. And vitamin D does have a role in maximizing hair quality. Now, that being said, for most men, we can also, once we do an examination where we examine the scalp with a microscope, we're able to establish that there is pattern loss, hair thinning. When hair goes from thick to thin to thinner and then disappears, that is very typical of androgenetic alopecia. And no genetic deficiency that I'm aware of really creates that type of pattern. Certainly nutritional status, and a lot of times people will want to just check their hormones, and so certainly going to an endocrinologist or medical doctor to have this done is fine. But I would say that it is generally quoted that 95% of hair loss is pattern hair loss. Now, in our practice, to help people with pattern hair loss, we do something called hair regeneration. Hair regeneration has been a development that's been very successful in our practice to help people with thinning hair. Certainly, I am all for supplementation, nutritional supplementations, whether it's in the form of multivitamins and omega-3 fatty acids. But when you realize that even people with nutritional deficiencies and less than optimal living conditions and other stressors can actually have amazing hair, you realize that really it's most likely a genetic pattern. With hair regeneration, what we do is we combine platelet-rich plasma with acellular matrix, and it's an injection, it's not a surgery, to help stop the progression of hair loss, reverse the thinning process so that hair that is thinning becomes thicker, and to reactivate hair that is not growing to start growing. Now, with 99% success for both men and women, we can imagine that we have patients who come here from all over the world, and we even started a company called TrichoStem Hair Regeneration to help people get access to this type of technology outside of our office. Now, going back again to the question of blood tests, As a general rule, yes, you look at thyroid hormone, you look at iron levels, you look at liver function tests, you look at the hormonal levels, testosterone, etc. Again, this is something that you can certainly do to get peace of mind. A lot of times people come to us, usually we're not the first line. Usually they come to us after they've exhausted everything else. But it is routine for someone to come and they'll have not only those types of workup in the lab test, but they'll also get rheumatologic workup, autoimmune workup. And basically they want to make sure that everything that could be possibly leading to cause hair loss systemically has been checked and to at least deal with. Now when it comes to women, that's a different story. Women tend to have more of a sensitivity to variations in hormone levels. Women have reported how starting a birth control pill has resulted in hair loss. They've also reported that stopping a birth control pill, pregnancy, delivery, there's certainly a lot of hormonal issues, and so we take a lot more detail from that, and we want to establish a certain degree of stability when we treat women. With men in general, once we diagnose male pattern hair loss, the options of finasteride, minoxidil, and transplant are also discussed, and many choose to go with hair regeneration. So I hope that was helpful. I wish you the best of luck, and thank you for your question.